Hey everybody, welcome to our last video lecture on global mental health. This first slide is what's called a health barometer and shows you what kinds of health situations are going on in the world. The key part that I want you to pay attention to is that at the bottom there's the disease states by number surveyed, and as you can see, some of our psychological disorders show up in that list. Because when we think about health, we can't just think about physical health, we also have to think about mental health. Now, I recognize this health barometer is from 2011, but a newer barometer has not been produced by this company because global health data is actually very difficult to gather. One of the key pieces that I want us to focus on is how poverty intersects with mental illness. Poverty is a significant contributor to mental illness and vice versa. With that, poverty also contributes to lower education, and lower education can contribute to lower levels of health, physical and mental. So as we see, this becomes a vicious cycle that poverty can lead to more physical disorders, which can lead to more mental disorders, or vice versa. But poverty also increases your exposure to violence and trauma, which of course also, as we've now learned, can lead to other mental disorders as well. If we want to talk about solving mental health issues, we have to also talk about resolving poverty. Most of this PowerPoint also focuses on the importance of Maslow. And this is kind of my funny slide on Maslow because it pulls in the social media sites that might fulfill these. I include this one as kind of a joke to help you laugh, all right? But the better one is this Maslow's hierarchy of need. Most of you have seen Maslow's hierarchy as the 5 levels: physiological safety, love, esteem, and self-actualization. But in fact, there's an 8-level model that I want you to be familiar with. It's over here at the bottom. You have those first 4 levels: physiological safety, love, and then self-worth, self-esteem. But instead of self-actualization being a single piece, there's actually 3 parts of it: the need to know and understand, aesthetic needs, and self-actualization needs. The top 3 levels are what are called growth needs. These are things that we strive towards, but that the deficiency needs are what are the first 4 levels, and these are essential for your well-being. These 4 deficiency needs are the ones that I want you to pay a lot of attention to. Now, small note, there is a critique of Maslow that he's not being very multiculturally competent, because in some of the way you can read Maslow is the idea that until you meet a level, you can't move up. That's not actually true. You can be hungry, but still feel like your family loves you. There is some interplay with those 4 levels. What I really want you to pay attention to is how those 4 levels all together are essential for a person's well-being. Let's talk about some situations where those 4 levels are not guaranteed. When we talk about household game changers, there are some items that are probably present in either the home you grew up in or your home now that are game changers in that they are common items that would solve some of the most pressing problems of global poverty. Again, going back to some of these deficiencies. These game changers are radios, vitamins, mobile phones, clean water, and cook stoves. Things just like having a stove versus an open fire, or having vitamins, can contribute to some of the major health disparities that we see globally. Maslow's base level is physiological needs, and one of the big ones there is hunger. So this is the world's hunger map, where you can see some of the health disparities again. Now, yes, we are the lighter color on the map, but we're not completely clear. There's plenty of hunger here in the United States. You might even have gone to school with or have been a child who went hungry, not out of your own choice, but because there was not enough food. But the percentage of people who experience that greatly increases by those colors. So notice which parts of the world that have more red tones than we do. As I mentioned, there is, of course, hunger here in the United States, and this slide is specifically about children who are hungry in America. And I think what I really want you to see here is that it's more common than many of us talk about. So 1 in 5 children experiences hunger. 5% of households are labeled in the severe range, as in very low food security. Well, 5% of households is 6.3 million households. That's a lot of people. So take a minute and again, familiarize yourself with some of these statistics. Another really important point is clean water. Many people, globally speaking, do not have access to clean water, and many people worldwide don't have access to sanitation. You may have seen some commercials lately because many celebrities are starting to get involved with the push to try to get more clean water access to more parts of the world. But again, pay attention to just how. But again, if you go home and safely drink the water that comes out of your tap, then you're much more fortunate than people who are in other parts of our country and in other parts of the world. Clean water and nutrition go with that base Maslow stage. And without that, Maslow would say it would be impossible to move on to self actualization. After physiological, the next level up in Maslow is safety. And violence is a major player against that safety part of Maslow. So the next few slides talk a little bit about how common violence is, both here and in the world. And I just want you to familiarize yourself with these statistics as well. In one of your first readings, you had already talked about the service gap being the number of years between when symptoms develop and when someone gets treatment. One of the problems is that many countries in the world actually don't have a mental health care policy or a system in place to address some of this, and this would widen that gap dramatically. So who is responding? Who's helping? What we find, globally speaking, is that nurses tend to be the most common group that are helping across the world. It's one of the reasons why there are so many nursing students in our abnormal classes and why abnormal is often required for nursing students. From this slide, again, you can see that nurses are the primary responders, but you can also see that the number of mental health professionals dramatically increases as the income of the country goes up as well. This further points out the intersection of poverty. But here's the thing, it doesn't just have to be nurses. Everyone can contribute to increasing global mental health awareness and working towards providing solutions for people who need it. This video is very brief because this last module is very brief. The Waters text has already been kind of helping you understand some of the cross-cultural concerns, but at the end of the day, what I really want you to see from this is the importance of Maslow. Without those deficiency needs met, it would be unlikely that you'd be able to move up to self-actualization. So we have to address people's deficiency needs and their mental health at the same time. You can't just solve one or the other. With that, I hope you've enjoyed this very, very quick lecture, and I'll see you on the internet.